Mental health therapy together. Advice from clinicians and clients with intellectual disability. In our study, researchers met online with two groups of people: adults with intellectual disability who have been in mental health therapy, and licensed mental health clinicians like psychologists and therapists who treat adults with intellectual disability. We talked about what works well, what's hard, and how to make therapy better for everyone. Both groups gave us good advice and shared some common ideas. Clients said it's important to have someone who listens and tries to understand them. Clinicians said therapy should be a safe space where clients feel heard and respected. Clients liked when therapists used their interests, like pets, art, or games, to make therapy more comfortable. Clinicians use shared hobbies and interests like journaling to connect and build trust. Clients want to know what will be shared and with whom. Some felt uncomfortable when therapists shared information without clear permission. Clinicians said they tried to explain confidentiality and ask for consent before sharing any information with others. Clients said support people like caregivers, family, and staff help with rides, reminders, and communication, but some felt uncomfortable if support people took over or didn't respect their privacy. Clinicians said support people can help, but only if the client agrees. Clients liked using visuals, clear language, and extra time to think or respond. Clinicians use drawings, models, and hands-on activities to explain ideas, feelings, and tools. Clients liked when therapy was flexible and matched their needs. Clinicians taught different techniques like cognitive behavioral therapy, or CBT, and mindfulness practices, while adjusting the pace and structure. Clients said they worked with therapists to set their own goals, like managing emotions or becoming more independent. Clinicians said it can be hard to separate the client's goals from what others want. Clients said therapy helped them speak up for themselves and ask for what they need. Clinicians said they try to teach self-advocacy skills and involve clients in every decision. A few clients liked learning with others, but a lot preferred one-on-one therapy. Many felt left out, worried about talking in front of others, or judged after being removed from group therapy for rocking or fidgeting. Clinicians said learning from peers can be positive and powerful, but group therapy may need extra support, resources, and time. Clients said some therapists didn't understand their disability or used a general one-size-fits-all approach. Clinicians said there aren't enough trained therapists and systems are hard to navigate. This video is a clear language summary of the article "Working with Adults with Intellectual Disability and Clinicians to Advance Mental Health Treatment, Informing Practice Guidelines and Research," published in the Journal of Mental Health Research and Intellectual Disabilities. A link to the scientific paper is available in the video description below. The contents of this video were developed through funding from the National Institute on Disability, Independent Living, and Rehabilitation Research. For more information and resources, visit go.osu.edu/RRTC.